Sarah Chen stared at the gas pump display, her hand frozen on the nozzle. $87 for 3/4 of a tank. She'd been a mobile veterinarian for 12 years, driving her clinic on wheels across 3 rural counties. This morning, like every morning for the past week, the math had stopped making sense. The fuel to reach her appointments now cost more than what farmers could pay for livestock care. Her phone buzzed. Another cancellation. That made 4 today. "Can't afford the visit, Doc," the text read. "Gonna try to handle it myself." Sarah knew what handle it myself meant for a cow with a breech birth. She climbed into her van anyway, even though driving 40 miles to lose money was insane. Some things, she'd learned, couldn't be measured in dollars alone. What she didn't know, what none of them knew that Tuesday morning, was how a barrel of oil hitting $100 would unravel the invisible threads holding their lives together. Marcus Washington had exactly one rule for his rideshare driving: never pick up anyone more than 10 minutes away. At $5 a gallon, every mile was a negotiation with bankruptcy. He sat in the parking lot of Lincoln Elementary, watching his daughter through the window of her 4th grade classroom. The school had cut bus service 3 weeks ago. Budget cuts, they said. Fuel costs, they meant. Now parents like Marcus had to figure out how to work and pick up kids at 2:30 p.m. His phone lit up with a ride request. 12-minute pickup, 30-minute ride, $18 fare. He did the math automatically now, a skill he'd never wanted. Gas there and back, $7. After Uber's cut, he'd clear maybe $8 for 90 minutes of work and 25 miles of wear on his 200,000-mile Camry. The phone buzzed again. The fare had increased to $22. Surge pricing? Someone desperate. He thought about his daughter's face when he'd explained they couldn't go to Grandma's for Thanksgiving this year. Nashville was 300 miles away. That was 600 miles round trip, at least $70 in gas, a week's worth of groceries. Marcus accepted the ride. He always did. Desperation recognized desperation. Across town, Elena Rodriguez sat in her car outside the plasma donation center, trying not to cry. She'd sold her blood twice this week already. The attendant had told her kindly but firmly, not for another 4 days. She was a visiting nurse, or at least she had been until yesterday. The home health agency had cut her route in half, consolidating visits to save on mileage reimbursement. Half the route meant half the hours meant half the paycheck. Her elderly patients were the ones who suffered. Mrs. Patterson, with the surgical wound that needed daily dressing changes. Mr. Kim, who couldn't manage his insulin alone. The agency had told them to try telehealth for wound care, as if you could change bandages through a screen. Elena had driven to Mrs. Patterson's anyway this morning, off the clock, unpaid. The woman was 83 and lived alone. The infection spreading from her incision didn't care about fuel economics. Now Elena sat in the parking lot, calculator app open, trying to figure out which bill wouldn't get paid this month. Rent was non-negotiable. Electricity? She had a 1-year-old. You couldn't skip electricity. Car insurance was legally required. Phone? She needed it for work. What little work remained? That left food. She'd gotten good at making rice and beans stretch. Her daughter was still breastfeeding, at least. Small mercies. The irony wasn't lost on Elena. She drove around all day trying to keep people healthy while slowly starving herself. Dr. James Okonkwo had been medical director of County General's mobile COVID testing program for 2 years. This morning, he'd made the call he'd been dreading. "We're shutting down mobile operations," he told his team. The vans stay parked. The silence on the Zoom call said everything. They all understood. When diesel hit $6 a gallon, the math for running 3 mobile testing units across a county became impossible. The grant money that funded them assumed fuel at 2019 prices. "What about the trailer parks?" someone asked. "The migrant worker camps? They can't get to the fixed testing site?" James closed his eyes. I know. He knew exactly what this meant. Those communities would go unmonitored. Outbreaks would spread unchecked until someone ended up in his emergency room, too sick to save, infecting everyone in the waiting room. After the call, James sat in his office and did something he hadn't done since medical school. He cried. Not from the decision itself, he'd made harder ones, but from what it represented. They'd finally hit the wall where you couldn't save people simply because moving the help cost too much. At Riverside High School, Principal Anderson delivered the news to the music department. All field trips are suspended indefinitely, including the orchestra's regional competition. Maria Chen, no relation to Sarah the vet, felt her stomach drop. She was first chair violin, and this competition was her shot at scholarship money. College without scholarships meant crushing debt she couldn't afford. "But we've been practicing for 6 months," she said quietly. Principal Anderson looked pained. "The bus rental company tripled their prices. We literally cannot afford to send you." After school, Maria walked home instead of taking the late bus, also canceled, and calculated the cost of her dream dying. The conservatory she'd wanted to attend, $50,000 a year. Her family's income, $32,000. The scholarship she might have won, full ride. Gas prices had just stolen her future. When she got home, her mother was cooking rice and beans. Again. Maria didn't ask why. She already knew her mom's nursing route had been cut. She'd overheard the crying last week. Maria put her violin away and opened her laptop to research state schools. And one's close enough to commute to, if her mother could still afford the gas. Tom and Rachel Morrison sat at their kitchen table surrounded by spreadsheets that all said the same thing. Their small farm was dying. Not dramatically, not all at once. Just slowly bleeding out from 1,000 cuts measured in diesel, plowing the fields, diesel, running the irrigation, diesel, transporting goods to farmers market, diesel. The fertilizer they needed to grow anything, made from natural gas that tracked oil prices. We could cut the organic certification, Rachel suggested without conviction. Save on inputs. Tom shook his head. That's our only market advantage. Without it, we're just competing with industrial farms on price. We'd lose faster. Their son was at the state university, commuting 2 hours each way to save on dorm costs. Except now the commute cost more than the dorm would have. Last week, he'd asked if he should drop out. Tom had said no, but he wasn't sure it was the right answer anymore. Their daughter had stopped asking about horse riding lessons. At 11, she'd already learned to read the stress in her parents' faces and stopped wanting things. We could sell the back 40, Rachel whispered. They both knew what that meant. The back 40 was their future, the land they'd planned to pass to their kids. Selling it meant admitting the family farm ended with them. Tom reached across the table and took his wife's hand. They sat there as the sun set, watching their dream dissolve in a barrel of oil. Detective Lisa Park read the incident report and felt a familiar rage building. Another pharmacy robbery, the third this week. All of them hitting the same thing. Not cash, not narcotics, insulin. Diabetics were getting desperate. With gas prices soaring, many couldn't afford both insulin and the fuel to reach their jobs. Some were driving less, losing hours, losing income. Some had stopped driving to doctor appointments to save money, which meant rationing insulin to make it last. Black market insulin was booming, and people were dying. Lisa had arrested a woman yesterday, a kindergarten teacher, for stealing insulin for her husband. The woman had cried through the whole interview. He was skipping doses to save money. I couldn't watch him die. The prosecutor had quietly declined to file charges. Her patrol area had also expanded. The department had cut shifts to save fuel costs. Fewer cops covering more ground with less gas meant slower response times. Last week, they'd arrived too late to prevent a tragedy they might have stopped 6 months ago. Lisa drove toward the new call, watching her fuel gauge, hating that she had to think about it. How had it come to this? When did cops start rationing justice by the gallon? Pastor Williams stood before his dwindling congregation. Attendance had dropped by half in 6 weeks, not from failing faith, but from failing fuel budgets. His church drew from a 20-mile radius. Now 20 miles was a luxury. The church ran a food pantry, but donations had collapsed. The volunteers who used to drive in from surrounding towns couldn't afford it anymore. The food bank delivery service had cut their route. The mobile food truck that served the homebound elderly had stopped running entirely. He thought about Mrs. Chen, Sarah the vet's mother, though he didn't know the connection, who'd told him quietly after service last week that she was eating 1 meal a day to stretch her Social Security check. Gas for her weekly grocery trip had doubled. After the service, he sat in the empty sanctuary and prayed, not for divine intervention, just for wisdom to know what to tell people when the systems meant to help them failed because of the price of fuel. Dr. Sarah Chen made her decision on a Thursday afternoon, sitting in her mobile vet clinic in the parking lot of Riverside Feed and Supply. She'd run the numbers a dozen ways. They all ended the same. Her business was unsustainable. She was subsidizing animal care with her retirement savings, draining her daughter Maria's college fund to pay for diesel. She could stop, close the mobile practice, take a job at a suburban clinic where wealthy clients brought their designer dogs for teeth cleanings and organic food consultations. She picked up her phone to call Maria, to apologize for the college fund, to explain the math. Then she saw the text from Tom Morrison about his pregnant heifer. Sarah put the phone down. She started the van. She drove toward the Morrison farm, knowing she was driving toward financial ruin, unable to do anything else. Some threads. Once you're woven into them, you can't cut without unraveling yourself. Marcus Washington sat in his Camry outside his apartment, engine off, watching the fuel gauge. Quarter tank. Maybe 60 miles left. He had enough money for either a quarter tank of gas or dinner. His phone showed $17 in his bank account. Payday was Monday. It was Thursday night. A ride request popped up. Airport run. $70 fare. 40 miles. He did the math. He'd need at least $8 in gas to make it there and back, assuming no deadhead return. After Uber's cut, he'd clear maybe $45. $45 meant food for 3 days. It meant his daughter could eat more than rice and peanut butter. It meant making it to Monday. It also meant burning through the last of his gas to make $45, leaving him unable to work Friday or Saturday unless he spent half his earnings on fuel. The poverty trap in real time, spending money to make money to spend on making money. He accepted the ride. As he drove, he thought about his daughter asking why they couldn't visit Grandma. He thought about lies he'd told about the car being broken, about being too busy, about anything except, "We can't afford the gas." The passenger was a consultant heading home to California. She complained about the flight delay, about the uncomfortable seats, about the conference hotel's pillows. Marcus said nothing. He thought about how $70 was her minor inconvenience and his daughter's groceries. When he dropped her off, she tipped $5. Marcus pulled into a gas station and pumped exactly $13 of fuel. Enough for tomorrow. He'd worry about Saturday on Saturday. Elena Rodriguez stood in the hospital parking lot, holding the pink slip. They'd called it a restructuring. She called it what it was. They'd fired the most expensive home health nurses and were hiring new ones at lower pay. She had 2 weeks. Her phone rang. Mrs. Patterson. The call went to voicemail. Elena knew what it meant. The wound had worsened. The old woman needed help. Elena got in her car. She drove to Mrs. Patterson's house, used her key, and found the woman feverish and confused. The wound was infected. Badly. She called 911, rode with her in the ambulance, stayed while they admitted her for sepsis. The hospital social worker found Elena in the waiting room. "You're not listed as her nurse anymore." "I know. But you brought her in." "Yes." "On your own time?" Elena nodded. The social worker sat down beside her. "Why?" Elena thought about the question. Why had she spent gas money she didn't have to help a patient who wasn't her patient anymore? Why was she here instead of home with her daughter? Why couldn't she just let the system fail without her? "Because someone has to," she finally said, "and I was the someone available." The social worker was quiet for a moment. "She'll be okay, thanks to you." Elena nodded and stood up. She had $17 in her account. She'd just spent $4 in gas getting here. She walked to her car and calculated food or gas or food. The eternal equation. She chose gas. She could eat tomorrow. Her patients needed her today. On a Saturday morning, paths crossed in ways none of them would know. Maria Chen sat in the park, practicing violin because the house felt too small for her mother's stress. Sarah Chen drove past, heading to yet another farm call she couldn't afford. Neither saw the other. Marcus Washington drove Elena Rodriguez to the hospital, his passenger, her emergency shift. They didn't speak beyond pleasantries. Neither knew they were both counting dollars and miles, trapped in the same equation. Tom Morrison stood at the farmer's market that Principal Anderson had cut from the school's field trip schedule. He sold vegetables at a loss because throwing them away felt worse. Dr. Okonkwo bought tomatoes, knowing his mobile testing program was failing the very communities this farmer served. Lisa Park investigated a domestic violence call 3 blocks from where Pastor Williams was trying to organize a community meal with food donations that weren't coming because people couldn't afford to drive to drop them off. They were all connected, woven together by invisible threads of fuel costs and cascading failures. None of them could see the full pattern. Each felt their struggle was isolated, personal, a failure of their own resilience. But from above, if anyone had been looking, the pattern was clear. The $100 barrel had done what no crisis had managed before. It had made the invisible visible. The threads connecting every part of American life to cheap energy were snapping, one by one, and the fabric was tearing. Sunday morning, Sarah Chen sat in her van in the church parking lot, phone in hand. She'd missed half of last week's calls. Her savings were nearly gone. Maria's college fund was depleted. She opened the banking app to check her balance. $217, negative $300 on the credit card. Her phone buzzed. Text from Tom Morrison. "Heifer and calf both fine, thank you. Can't pay till harvest. Understand if that's not okay?" Sarah closed her eyes. Harvest was 6 months away. 6 months of unpaid bills, subsidized care, financial bleeding. She typed, "They're healthy, that's what matters. Pay when you can." She hit send before she could reconsider. A tap on her window. Elena Rodriguez stood there, still in scrubs from her hospital shift, looking exhausted. "Are you okay?" Ellen asked. Sarah laughed, surprising herself. "No, are you?" "No." They stood there in the parking lot, 2 women they'd never met, connected by nothing except being in the same place at the same time, both breaking under the same invisible weight. "I lost my job," Elena said. "I'm a home health nurse. They cut routes because of fuel costs. I'm a mobile vet. I'm going bankrupt for the same reason." They looked at each other, and something passed between them. Recognition, not of each other, but of the pattern they were both trapped in. "Coffee?" Sarah asked. "I can't afford coffee," Elena said honestly. "Neither can I, but I think I need to talk to someone who understands." They sat on the church steps while Pastor Williams arrived for service. He stopped when he saw them. "Everything all right?" "No," they said in unison. He sat down beside them. "Me neither." It started small, 3 people talking on church steps about problems that felt impossible because they were carrying them alone. Elena mentioned her patients losing care. Sarah mentioned her farm families losing animals. Pastor Williams mentioned his congregation members choosing between gas and groceries. "Wait," Sarah said. "Do your patients need wound care?" Desperately, but I can't afford to drive to them. What if you rode with me? I'm already driving to every farm in 3 counties. You could see homebound patients on my route. We'd split the gas cost. Elena stared at her. That might actually work. Pastor Williams leaned forward. My church has a commercial kitchen. We stopped doing the community meals because volunteers couldn't afford to drive in. But if people are already going to be driving for other reasons... You could coordinate routes, Elena said, excitement building. People heading the same direction could carpool, share gas costs, multiply what 1 tank of fuel accomplishes. Sarah pulled out her phone, opening her calendar. I'm heading to the Morrison farm this afternoon. Tom sells vegetables. If he's making a farmer's market run, maybe he could deliver food pantry goods on the same trip. They sat there, phones out, connecting dots, weaving new threads. It wasn't a solution. It didn't fix the $100 barrel or bring back Elena's job or save Sarah's business or restore Marcus's ability to visit his mother. But it was something, a refusal to let the threads stay broken. Monday morning, Elena Rodriguez sat in Sarah Chen's mobile vet clinic heading toward the Morrison farm. Sarah was checking on the heifer. Elena was seeing Mrs. Patterson, who'd been discharged back home. Tom Morrison had agreed to drop off food pantry goods at 3 locations along his market route. Pastor Williams had organized it. Marcus Washington had signed up to drive elderly church members to medical appointments. They'd pool gas money, and he'd make more than he would doing scattered rideshare runs. Lisa Park had convinced the department to create a community coordinator position to track and share resource trips. Dr. Okonkwo had partnered with the mobile vet clinic to add COVID testing stops to their existing rural routes. None of it was perfect. All of it was held together with duct tape and hope, but it was working. Maria Chen had started a student carpool network, connecting kids who needed rides to after-school activities with parents already making the drive. She wouldn't make her orchestra competition, but she'd helped 37 students stay in sports and music programs. You know what's crazy? Elena said as Sarah drove. Oil prices haven't dropped. Nothing changed except us figuring out how to carry the weight together instead of alone. Sarah nodded. My business still isn't profitable, but at least it's less unprofitable. And you're seeing patients again? Because we stopped pretending we could do it alone. They rode in comfortable silence for a while, watching the rural landscape roll past, burning fuel they still couldn't really afford, doing work that still didn't pay enough. But doing it together made it possible in a way that doing it alone hadn't. 3 months later, the network had grown beyond anyone's imagination. The Mobile Resource Coalition, as they'd named it, coordinated 73 different professionals and services across the county. Nurses, vets, mobile mechanics, home health aides, tutors, music teachers, social workers, all coordinating routes to maximize what each tank of fuel could accomplish. Marcus Washington had become a de facto logistics coordinator using his rideshare route knowledge to optimize everyone's driving. He'd quit Uber entirely. The collective paid him a coordinator salary pooled from everyone's fuel savings. Tom Morrison's farm had become a distribution hub. He was still barely breaking even, but now his farm-to-market runs moved food, library books, medical supplies, and served as a pickup point for those who couldn't afford to drive into town. It wasn't utopia. Oil hadn't gone back down. Elena still struggled to pay rent. Sarah's savings were still depleted. Maria had still lost her scholarship shot. Pastor Williams' congregation was still half its former size, but they were surviving. Together they'd found the gaps in the fabric where their threads could interweave, supporting each other across the tiers. Sarah Chen sat in her mobile clinic one evening, updating her route map. Different colors for different services. Blue for vet calls, red for nursing stops, green for food delivery, yellow for equipment transport. The map looked like a spider's web, each thread connected to others, creating a pattern of mutual support across the county. Her daughter Maria appeared in the doorway. Mom, can we talk? Sarah braced herself. This was it, the conversation about giving up on college entirely. I've been thinking, Maria said, about the conservatory, about the scholarship I didn't get. Sarah's heart broke a little more. I'm not going, Maria continued, but not because of money, because of this. She gestured at the map. You created something here, Mom. You and Elena and Marcus and everyone. You rebuilt what broke. You adapted. When the system failed, you didn't wait for someone to fix it. You fixed it yourselves. Sarah shook her head. We haven't fixed anything. Oil's still $100. People are still struggling. But they're struggling together instead of alone. That's not nothing. Sarah looked at her daughter. When had she gotten so wise? And felt something shift in her chest. Not hope, exactly. Something more solid. Resilience, maybe. Recognition that sometimes the answer isn't solving the problem, but refusing to let the problem solve you. Oh, what will you do instead? She asked. Maria smiled. I'm going to state school. Close enough to commute when gas is expensive, live on campus when we can afford it. I'm switching my major to logistics and community organizing. Because this, she pointed at the map, this needs to scale. Other counties are failing the same way we almost did. Someone needs to teach them what you figured out. Sarah felt tears threatening, pride and pain mixing into something new. Your scholarship is teaching people that when the system breaks, you don't have to break with it. You just have to find the other people who refuse to break and thread yourselves together. Oil stayed above $100 a barrel for 11 more months. The Mobile Resource Coalition spread to 47 counties across 6 states. Maria Chen's senior thesis on mutual aid logistics in resource-scarce environments won national recognition and led to a nonprofit startup. Marcus Washington became director of Rural Transportation Solutions. Elena Rodriguez trained community health workers to coordinate mobile care. Tom Morrison's farm became profitable when it doubled as a community hub. Pastor Williams' church became a coordination center for resource sharing across denominational lines. Dr. Okonkwo partnered with the network to create a mobile health surveillance system that worked better than the traditional public health model. Lisa Park helped develop a community policing approach that reduced domestic violence calls by addressing the economic stress that triggered them. Sarah Chen never got rich. Her mobile veterinary practice remained barely viable even with cost sharing. But she kept running it, kept weaving her thread into the larger fabric. Because that's what she'd learned. In a crisis, the question isn't whether you can survive alone. It's whether you can find the others who are trying to survive and weave yourselves together strongly enough that when one thread strains, others hold. The $100 barrel had broken the old world, but in breaking it, it revealed something underneath, that the systems they'd relied on had always been fragile, held together by cheap energy and unlimited growth. What they built in its place wasn't perfect. It wasn't even efficient, but it was resilient in a way the old system never was, because it was built on threads between people, instead of assumptions about oil. When prices finally dropped, and when the crisis that had seemed permanent became history, the network didn't dissolve. It had become something more valuable than a response to high fuel costs. It had become proof that community isn't what survives a crisis. Community is what you build during the crisis, thread by thread, person by person, decision by decision. The $100 barrel taught them all the same lesson. You can't control the price of oil. But you can control whether you face its consequences alone or together. And together, they learned, was the only way that mattered.